Sexually Transmitted Infection Prevention, presented by Mary Cunningham, Morgan Myers, Sumi Lee, and Victoria Fulforth. Sumi is a healthy 16-year-old female. She has no known medical history. She lives with 3 brothers and her father. Her mother passed away when she was just a toddler. She leads an active lifestyle and eats well. She is very involved with her high school as a cheerleader and playing soccer. She's also an honor roll student. She recently started dating her boyfriend about a month ago. He's a 17-year-old male who plays football and tennis. She admits that she is considering being sexually active with her partner, stating that they are in love. She admits to having intercourse once without a condom. Her father does not feel comfortable talking to her about sex, and sex education is not offered at her school as part of the curriculum. She is curious about how to protect herself from sexually transmitted diseases. Her boyfriend claims that she is the only one, but she worries because he has a reputation. The following will detail a teaching-learning session with Sumi to teach her how to protect herself from sexually transmitted infection. Tori, the community health nurse, was approached by Dr. Smith after the visit at the office. Dr. Smith asked Tori to speak with Sumi in regards to sexually transmitted infections. Morgan is also a community health nurse, and she will also be working with Sumi to help her understand how to protect herself from STIs. In this video, you'll see Tori and Sumi having a discussion about sexually transmitted infections and how to prevent them.
Hi Sumi, I'm Tori. I'm the community health nurse. I just met with Dr. Smith and we reviewed your charts, and I saw that you're having sex but you're not using protection.
Well, my boyfriend said it's okay not to use it, and then he also told me that I'm the only one, so.
Okay, so I'm going to actually go over with you some barrier methods and abstinence to protect yourself, because by having unprotected sex, you're actually putting yourself at risk for several diseases. Do you mind putting your phone down?
Oh, okay.
Okay, thank you. Okay, so the safest method to protect against STIs is actually abstinence, so not engaging in sex. However, if you're going to, I would recommend using either the male condom or the female condom.
What is female condom?
So for the female condom, you're actually going to insert it into yourself. Does that sound?
Oh, no. I don't want that.
Okay, so I'll go over with you the male condom. I'll have the other nurse come in to teach you how to apply it, but I'm just going to go over with you some STIs and the risks associated with them.
Okay.
Okay, so common STIs are actually chlamydia and gonorrhea. So some symptoms would be having any discharge, if you're having pain or burning during urination. That could be the sign of an STI, or it could be a UTI. So we're going to want you to call the doctor, and you're going to come in, you're going to be tested.
Okay.
Some other signs would be pain in the abdomen, blisters, open sores, warts. That could be a sign of herpes.
Okay.
And any rash or swelling in the genital area. However, some STIs don't have symptoms, so you could have one without noticing anything. So anytime you have a new partner, you're going to want to get tested.
I see.
Okay. Do you have any questions?
Well, I don't know why. Is that really important? Like, if I get STI, if I get some medicine, don't you think that will be okay?
Okay, so actually with the STIs, you can get treated, some can go away, some however are permanent, and even the ones that do go away can have some long-term consequences, such as sterility, which is loss of ability to get pregnant.
Oh, I don't want that.
No. There's also cancer of the cervix in women.
Ooh.
You can also damage other parts of your body, such as your heart, your kidneys, and your brain.
Oh, that's awful.
Yeah, so I'm going to have the other community health nurse come in, and she's going to show you more about the male condom. Is that okay?
Yeah,
Okay.
thank you.
And I'm going to leave this with you.
Sure.
In this video, Morgan goes further into detail with Sumi about her chosen method of protection against sexually transmitted infection, the condom.
Hi Sumi, I'm Morgan. I'm a community health nurse. I understand that you just met with Tori. Now that you've had time to look over your pamphlet, do you have any questions I can answer for you at this time?
My question is, he said I'm the only one, and I don't know why I am at risk.
Risk factors for STI includes multiple partners and unprotected sex. Because you've had unprotected sex, you could be at risk for an STI if he has had any sexual activity with anyone who has been infected in the past.
Oh,
Okay?
okay.
Now, do you know how to put a male condom on?
I've never done.
No? Okay, so I'm going to tell you a little bit about condoms, where you can find them, how to store them, and how to put them on. Because it's important that you not rely on your partner and that you know how to do it for yourself, that you know how to put a condom on because it is your body. Okay?
Okay.
So you can find condoms at drugstores, grocery stores. You don't need a prescription. You can just go in and buy them. It's important that you store them in a cool, dry environment at room temp. So I'm going to open this up. The condoms come in a little package like this. There's different brands, so they may not all look the same.
Okay.
So we're going to use bananas. I'm going to give you this one. First, I'm going to demonstrate how to put the condom on, and then I'm going to have you show me.
Sure.
Okay? So first we're going to tear the package. Okay. So here's the condom. It's important to leave a little space at the top so that when we roll the condom on, it does not break. Okay? So we're going to put the condom on the tip of the penis, leaving a little space. It's important that you put a condom on when the penis is erect and not flaccid. Otherwise, the condom won't go on properly. Okay? So once you leave a little space, just pull down on the rim. Make sure that there's space at the tip of the penis. Pull the condom all the way down. And that's how you properly put on a condom. Okay? Now, can you demonstrate to me how to put the condom on the banana?
Sure. So, okay, first. I open it. Put it in. Little space.
Yes.
I did it.
Good job. Now I'm going to show you how to take the condom off,
Okay.
because that is just as important. So when taking a condom off, first you want to make sure the penis has left the vagina. You're going to hold the tip, and you're going to peel it off and pull it off and discard into the trash can. Okay?
So, take it off. Oh. And throw it away.
Throw it away.
Okay. Now I know how to do it.
Now it's important that you don't leak any of the semen out of the condom. Okay? So it's important to discard after you've taken it off the penis. Take the penis out of the vagina while it's still hard and not soft to prevent any breakage of the condom, okay? Do you have any questions on how to put a condom on?
No, I think I know now.
Okay, great. Now, because you have had sex and you did not use any protection, I would recommend that you schedule a follow-up STI screening just to make sure that you have not contracted any STIs. Okay?
Okay, I will.
And it is also very important to always remember that the only sure way to ensure that you don't contract an STI is through abstinence. But if you are going to be sexually active, it's important that you use a method like the male condom in order to protect yourself and your partner.
I see. Thank you.
Now, after the STI screening, if it does come back that you have contracted something, it is also important that your partner comes and gets treated too. Screened and treated. Now, I'm going to give you this condom. We give free condoms at the clinic. You can also, like I said, get condoms at drugstores, grocery stores. Okay?
Thank you.
You're welcome.
This video will show a phone conversation between Morgan and Sumi occurring 1 month after Sumi's visit to the office.
Hello?
Hi, Sumi. It's Morgan from Dr. Smith's office.
Hi.
I'm just calling to follow up and see how you're doing.
I'm doing great.
Good, good. Are you utilizing the skills that we talked about in your appointment?
Yes. I actually, used condoms with my boyfriend, and then he was kind of embarrassing and he didn't like, to use it, and then he didn't know how to use it. So I told him, and we are using it.
That's good. That's great to hear that you're utilizing the tools that I taught you at your last appointment. Now, did you ever schedule your STI testing?
It was last Tuesday.
Okay, how did that go?
They said it's all good.
Good, good. Now, since your test came back negative, it is important that you continue to use the barrier methods that we talked about at your appointment in order to keep you and your partner safe from STIs.
Okay.
Okay, it was great talking to you.
Thank you.
Bye.
Bye.
Let's talk about sex, baby. Let's talk about